Hi, my name is Carolyn Warner-Greer. I'm board certified in obstetrics and gynecology and addiction medicine, and today I want to talk a little bit about tobacco use in pregnancy. The good news is that the amount of people smoking cigarettes in the United States has steadily declined over the last 10 years. A little bit of this, I think, is related to increased awareness of all the negative outcomes of smoking cigarettes, and a little bit is associated with the increased cost of smoking cigarettes. Only about 18% of women who are pregnant smoke cigarettes. The bad news is that the negative impact of smoking cigarettes during pregnancy is significant. We know it is related to premature delivery, the bag of water breaking early, low birth weight, intrauterine fetal death, or the baby simply passing away before the baby's born. The good news is that we can help you. Just like with any other substance use disorder, being addicted to nicotine is significant and it's hard to stop on your own. Your obstetrician can help you with these things, though. We know that unlike some other substance use disorders, and especially tobacco, medicines are not as always helpful during pregnancy. We haven't found that nicotine replacement, such as patches or gum or lozenges, is as helpful in pregnancy as it is for people who aren't pregnant, meaning it doesn't always result in people stopping smoking. Therefore, the risk is not as helpful. However, if someone is really dedicated to stop smoking, let's say in like 2 weeks or a month, those nicotine replacement products can be used. Medications that you see on TV sometimes, like varenicline or Chantix or Zyban or bupropion, can be considered in pregnancy, but again, some of the risks to the unborn child are not really well known, so those are usually reserved for special cases in pregnancy. The one tool that's super helpful for all people but is not used as widely is known as cognitive interventions. Something as simple as just talking to your doctor at every visit about how to stop smoking. Being paired up with someone who can motivate you, having a phone number to call and having someone call you on a regular basis and asking how you're doing. These things are very, very helpful in being able to stop smoking, not just for your pregnancy, but for after your pregnancy. Because one of the most staggering statistics is about 75% cases of sudden infant death syndrome occur in a home where there's someone who smokes. Not around the baby, but just smokes. Another issue that's coming up is how do e-cigs or electronic nicotine delivery systems, how do those impact smoking and outcomes in pregnancy? Well, we found one is that people who switch from cigarettes to e-cigs do not stop smoking at any greater rate, and in fact, eventually may end up smoking more cigarettes than they did before they started. We have not been able to show that the carcinogens involved in these e-cigs are any significantly less than are actually involved in cigarettes. So the American College of OBGYN and the American Academy of Pediatrics, who would be pretty much the authority on the mother and the child during pregnancy, both would recommend that e-cigs are not an appropriate substitution for tobacco and they should be avoided in pregnancy. For more questions on how you can avoid tobacco use and become a smoke-free household, I ask you to talk to your obstetrician gynecologist.